Good afternoon, everyone. Just wanted to call this meeting of HHS to order. This is one of our final meetings, if not the coming up. But at this moment, we'd be going through the decisions that was made by the committee. I want to start by saying it was a privilege or honor, but also just thanking the committee members at that time for the hard work and diligence that's went through this. At this time, I'll swing it over to my good analyst, Morgan Smith, and she'll direct us through the rest of it.
Thank you, Mr. Chairman. We're going to start on page 1 with Naomi with the Office of Deaf and Hard of Hearing.
Thank you, Morgan. Thank you, Mr. Chair. So with the Office of Deaf and Hard of Hearing on page 1, DLS recommend adopting committee narrative requesting cost estimates for options to regulate sign language interpreters. The agency concurred and the House adopted.
Approved, concur with the House.
On page 2, for the Department of Disabilities, DLS concurred with the governor's allowance. The agency concurred and the House adopted.
Move to concur. Moving to second, concur with the House.
On page 3, we have the Executive Department's boards, commissions, and offices. The first item is narrative requesting report on minority business enterprise participation attainment liaison surveys. The agency concurred and the House adopted.
Move to concur. Move to concur and second, approved.
Also in the Executive Department's boards, commissions, and offices, the House deleted $5 million in general funds for the Maryland Corps program, stating that it was duplicative of the funding and mission established within the new Department of Service and Civic Innovation.
Mr. Chairman, I move to reject the House action and fully restore the $5 million that was cut.
The motion has been moved and seconded to reject the House and fully restore $5 million. Approved.
On page 5 for the Secretary of State, the DLS recommends concurring with the governor's allowance. The agency concurred and the House adopted.
Move to concur.
Moved and second, concur with the House.
On page 6, Department of Legislative Services had 2 recommendations under the Department of Aging. The first was to adopt committee narrative requesting a report on waitlist and program participation. The agency concurred and the House adopted.
Move to concur. Moved and second, concur with the House.
Great. And on page 7, the second recommendation was to adopt committee narrative requesting an update on the spend down of federal stimulus dollars by local area agencies on aging. The department concurred and the House adopted.
Move to concur. Moved and second, concur with the House.
Great. And then there's one additional piece for your consideration, which is the first page of the color page packet, which is to adopt committee narrative requesting an update on the Human Services Administrator 2 position that's been vacant at the department for more than 2 years.
Move to adopt committee language.
Moved and second, adopt committee language.
And then turning back to your main packet on page 8 and 9 are recommendations for the Maryland Commission on Civil Rights. The first is to adopt committee narrative requesting an update on employee retention and recruitment at the commission. The commission concurred and the House adopted.
Move to concur.
Moved and second to concur with the House on items number 1 and 2.
On page 10, the military department begins. DLS recommended adopting committee narrative on the TRICARE Reserve Premium Reimbursement Program. The agency concurred, the first House rejected.
We concur with the House. We'll reject as well.
Moved and second, the committee moves to concur with the House to reject.
Moving on to page 11 for additional first House actions. The House deleted $5 million in general funds budgeted for the TRICARE Premium Reimbursement Program and then struck language. You'll find for your consideration an additional page, not in the color page packet. It's just by itself. An additional item that would restore $250,000 for the TRICARE Premium Reimbursement Program and amend language as a technical amendment.
Mr. Chairman, I move to modify by simply adopting this additional page.
It's been moved and second to modify and adopt additional page restoring the $250,000.
Finally, you'll find back in the main packet, the House adopted the following narrative for health insurance for National Guard members.
Move to adopt.
Moved in second, move to concur with House.
I think we want to reject.
Oh, wait,
that
which,
house.
give me the item
It's
number.
page 11, number 3.
Oh, I'm sorry. with that. Yeah, I'm sorry. Reject House and reject House to Senate narrative, please.
Strike
Yep.
the narrative.
Yep.
It's been moved in second to reject the House and strike the narrative.
Moving to Maryland Institute of Emergency Medical Services Systems on page 13. DLS recommended concurring with the governor's allowance. The agency concurred and the House adopted.
Move to concur.
It's been moved in the second, committee concurs with the House.
Page 14, we have the state archives. The original recommendation was from DLS to concur with the governor's allowance. The agency concurred and the House adopted. We also have additional budget language here in page 2 of the additional packet to provide that $50,000 of the appropriation made for the purpose of agency administration is restricted pending a report detailing a plan for filling all positions that have been open since on or before December 31st, 2021.
I move to adopt color page 2.
Moved in second to modify and adopt the color page.
On page 15, you'll see the Maryland Health Benefit Exchange. There are 2 items for your consideration. The first item would require the exchange to notify the subcommittee when state innovation waiver applications have been submitted. And item number 2 would require the benefit exchange to submit a report on the reinsurance program costs and forecasts. The agency did not provide a response for either one of these items, and the House adopted both.
I move to concur with both items.
It's been moved and second to concur with the House on both items number 1 and 2 on page 15.
Page 16 has the West North Avenue Development Authority. This is a new agency. The first recommendation is that they participate in the MFR process. Agency concurs, first House adopted.
Move to concur.
It's been moved to concur with the House on item number 1 on page 16.
Second item is that also since 90% of their budget, $10 million is for grants, we recommend that there be a grants manual. Also, agency concurs in part, first House adopted.
Move to concur.
Moved in second to concur with item number 2 on page 16.
The State Department of Assessments and Taxation begins on page 18. DLS recommended adopting committee narrative for real property evaluation vacancies in the program. The agency concurred and the first House adopted.
Move to concur.
Moved in second to concur with item number 1 on page 18.
DLS also recommended adopting narrative on the homeowners tax credit and renters tax credit eligibility standards. The agency concurred and the first House adopted.
Move to concur.
It's been moved in second to concur with item number 2 on page 19.
Item 3, DLS recommended adopting committee narrative for the Cloud Revenue Integrated System Status Report. The agency concurred and the first House adopted.
Move to concur.
Moved in second to concur with the House on item number 3 on page 19.
On page 21, you'll find an additional first House action for the State Department of Assessments and Taxation to adopt narrative on tax credit program processing and compliance efforts. The first House adopted.
Move to concur.
It's been moved in second to concur with item number 1 on page 21.
Moving on to page 23 for the Property Tax Assessment Appeals Board. DLS recommended concurring with the governor's allowance. The agency concurred and the first House adopted. But if you look at page 3 in your color page packet, you'll find one additional item for you all to consider: adopting a narrative on the Baltimore City Property Tax Assessment Appeals Board backlog.
I move to modify the action by adopting color page 3.
It's been moved in second to modify the item number 1 and adopt the color page number 3.
Moving to MDH administration on page 24. The first action restricts funds pending report of ongoing impacts of the December 2021 cybersecurity incident. The agency concurred and the House adopted.
Move to concur.
It's been moved in second to concur with the House on item number 1, page 24.
Number 2 on page 25 restricts funds pending report of ongoing high vacancy rates. The agency concurred in part requesting a change of the due date to December 15th, 2023, and House modified to accommodate the due date change.
We move to concur with the House modification.
It's been moved in a second to concur with the House modification for item number 2 on page 25 that extends over to page 26.
The third action on page 27 restricts funds pending report on IST and NCR placement times. The agency concurred and the House adopted.
Move to concur.
Moved in second to concur with the House on item number 3, page 27.
Number 4 on page 28 restricts funds pending report on patient and staff safety measures. The agency concurred and the House adopted.
Move to concur.
Moved in second to concur with the House on item number 4, page 28.
Number 5 on page 29 is a DLS action to reduce funding for accelerated provider rate increases by 25% to align with the original October 1st start date of the accelerated provider rate increases. The agency concurred in part, stating that they were working with DBM, and the House modified to move in accordance with the move of the start of the accelerated provider rate increases to January 1st, which would be a 50% reduction instead.
Concur with the House modification.
It's been moved in second to concur with the House modification for item number 5 on page 29.
Number 6, starting on page 29 and ending on page 30, recommends committee narrative requesting report on the opioid restitution fund revenues and expenditures. The agency concurred and the House adopted.
Move to concur.
It's been moved in second to concur with the House action for item number 6, page 29.
Number 7, starting on page 30 and ending on page 32, restricts funds pending report on applications and admissions to the 2 chronic care hospitals and the Holly Center. The agency concurred and the House adopted.
Move to concur.
It's been moved in second to concur with the House action for item number 7 on page 30 to 32.
Then the additional House actions, the first one on page 33 is contingent language reducing general funds for the accelerated provider rate increase beginning on January 1st, 2024.
Move to concur.
Moved in second to concur with the House on item number 1, page 33.
And then action number 2, similarly, this reduces federal funds for the accelerated provider rate increases beginning on January 1st, and the House adopted.
Move to concur.
Moved in second to concur with the House on item number 2, page 33.
And the third additional action recommends, starting on page 33 as well, ending on page 34, recommends committee narrative requesting report on changes to security attendant training in the hospital system, and the House adopted.
Move to concur.
Moved in second to concur with the House on item number 3 on page 33, extending to page 34.
Moving to page 35 for actions related to the Office of Healthcare Quality. This first item increases budgeted turnover from 0% to 7%. The agency disagreed. The first House adopted.
Move to concur.
Moved and seconded. We concur with the House on item number 1, page 35.
Item 2 on that same page is narrative requesting a report on the progress to restore survey reporting following the MDH ransomware attack. The agency disagreed with the report requirement and the House adopted the narrative.
Move to concur with the House.
Moved in second, concur with the House on item number 2, page 35.
On page 36, there's an additional first House action that added narrative requesting a report on medication prescribing and diagnosis practices in nursing homes and assisted living facilities. So the first House adopted that.
Move to concur.
Moved in second to concur with the first House action for item number 1, page 36.
And then there's an additional item for your consideration on page 4 of the second packet. This is narrative requesting reports on MDH's progress in adopting revised regulations related to assisted living facilities that was required in 2021 legislation.
Move to adopt.
Move to adopt color page number 4.
Starting on page 38 for the health professional boards and commissions. Item number 1 would restrict $150,000 until the Board of Dental Examiners submits a report on their performance measures. The agency disagreed because this piece of language was originally surrounding a report. The House adopted.
Move to concur with the House.
Moved in second to concur with the House on item number 1, page 38.
And there is an additional item for your consideration on page 5 of the color page packet. This one would restrict $25,000 for a handful of boards until they submit a report on their timely investigation goal.
Move to adopt.
Moved in second to adopt color page number 5.
Page 39 of your main document. Under the Public Health Administration, DLS recommends adopting language restricting funding pending submission of a report on public health staffing. The agency concurred in part, requesting a later due date, and the House adopted the modified language on page 40 and 41 with that later due date.
Chairman, I think they've been good partners on that. I'd move to agree with the House and go with the later date.
Moved and seconded to adopt item number 1 on page 39 that extends all the way over to page 41.
Great. Then on page 41 and 42, the second recommendation is to adopt a narrative requesting a report on the Public Health Services Data Modernization Project. The agency concurred and the House adopted.
Move to concur on both items.
Moved and second to concur with item number 2, page 41.
Item number 3, starting on page 42, extending to page 43, is recommending adopting narrative requesting a report on the status of the Office of the Chief Medical Examiner's accreditation and autopsy backlog. The agency concurred and the House adopted.
Move to concur.
Moved in second to concur with the House on item number 3, page 42.
Great. And then there's one other item for your consideration on page 6 of the color page packet, which is to adopt narrative requesting a report on the Office of the Chief Medical Examiner's recruitment to fill vacancies that have been unfilled for more than 1 year.
Move to adopt.
Moved and seconded to adopt color page number 6.
And moving back to the main decision document, the first item on page 44 for the Prevention and Health Promotion Administration is narrative requesting reports on mobile COVID-19 vaccine clinics and missions. This is a repeat from a narrative that was requested in last year's Joint Chairman's report. The House adopted.
Move to concur.
Moved in second to adopt item number 1 on page 44, concur with the House.
Then item 2 at that same page and on to page 45 is also narrative requesting a report on laboratory testing capacity. Again, this is a repeat narrative from what was requested last year. The House adopted.
Move to concur.
Moved in second to concur with the House on item number 2, page 44.
And then item 3 at the bottom of page 45 is a DLS recommendation for narrative requesting a report on Medicaid claiming in school-based health centers. MDH concurred and the first House adopted.
Move to concur.
Moved in second to concur with the House on item number 3, page 45.
Moving to the Behavioral Health Administration on page 47. The first action restricts funds pending a report on the ASO provider overpayment recoupment after the turn of the calendar year. The agency concurred and the House adopted.
Move to concur.
Moved in second to concur with item number 1, page 47.
The second action, starting on page 47 and 48, restricts funds pending a report on statewide telebehavioral health utilization. The agency concurred and the House adopted.
Move to concur with the House.
Moved in second to concur with the first House action, item number 2, page 47, extending over to 48.
The third action on pages 48 and 49 restricts funds pending a report on the accessibility of Medicaid assisted treatment for opioid use disorders. The agency concurred and the House adopted.
Move to concur.
Moved in second, we concur with the first House on item number 3, page 48, extending over to 49.
Number 4 on page 49 recommends committee narrative requesting data on non-Medicaid behavioral health service utilization. The agency did not respond. The House adopted.
Move to concur.
Moved in second to concur with the House on item number 4, page 49.
Number 5 on page 50 is annual language, restricting non-Medicaid community service reimbursement funds to the 3 reimbursement programs. But no response from the agency and the House adopted.
Move to concur.
Moved in second to concur with the House on item number 5, page 50.
Number 6, starting on page 50, ending 51, was the first of several actions related to the behavioral health infrastructure investments. This was DLS's recommendation to restrict 50 million of the behavioral health infrastructure investments pending report on specific uses of the funds. The agency disagreed, saying that they were working with DBM. The House modified the action to specify that the fund should be used for one-time investments.
I concur with the House to reject the DLS recommendation.
It's been moved in second to concur with the House to reject the DLS recommendation for item number 6, page 50.
Number 7 on page 52 is a recommendation to reduce the general fund for the behavioral health infrastructure investments, given that 20 million in funds in ARPA funds were unallocated. The agency disagreed, saying that the ARPA funds were already allocated. The House rejected the action.
Mr. Chairman, I could definitely see where the administration is coming from. I would move to reject the language added by the House.
It's been moved and seconded to reject the language added by the House on page 51.
Number 8 on page 52, again, annual language restricting reimbursement funds for non-Medicaid community service for Medicaid enrollees to the 3 reimbursement programs. No response from the agency and the House adopted.
Concur with the House.
It's been moved and second, concur with the House to reject the DLS recommendation, item number 7, page 52.
And number 9, also annual language restricts Medicaid provider reimbursement funds to the 3 reimbursement programs. No response from the agency and the House adopted.
Concur with the House.
Moved and second to concur with the House on item number 9, page 53.
Number 10 on page 53 reduces the general fund appropriation for provider reimbursements by 40 million based on a lower forecast of Medicaid enrollment. The agency disagreed, saying that there was still uncertainty in enrollment forecasts, but the House adopted.
I'd move to concur with the House, given the current forecast.
It's been moved and second to concur with the House to reduce the funds, item number 10, page 53.
Numbers 11 and 12 on pages 53 and 54. The first, number 11, reduces general fund deficiency appropriation for fiscal 2023 for provider reimbursements by 14 million due to a budgeting error. And number 12 reduces the general fund in one of the Medicaid programs by 86 million, also due to a budgeting error, for a total of 100 million.
Mr. Chairman, I'd move to concur with the House actions to reduce the funds that are not necessary.
It's been moved and second to concur with the House to reduce the funds for item numbers 11 and 12 on page 53.
We did have those, sorry. Additional items on page 54. The first additional item is about the behavioral health infrastructure investments also. Oh no, this is the utilization data, sorry. Behavioral health utilization data for children and young adults. The House adopted, sorry.
Move to concur.
So moved in second to concur with the House on item number 1, page 54.
The second action is the 70 million, the restriction of 70 million of the behavioral health infrastructure investments to one-time uses, along with the 1.8 million specifically for Brooklyn Hospital renovations.
I'd I'd move to reject the House action.
It's been moved and second. We reject the House actions, no restriction on the use of funds for item number 2, page 54.
We'll now move to the Developmental Disabilities Administration on page 56. Item number 1 would restrict $100,000 until the agency reported on the decline in community services participants being served in all DDA waivers. The first House modified this language to include additional reporting requirements.
I'd move to modify the language adopted by the House.
It's been moved and seconded to modify the language and adopt item number 1 on page 56.
And for your consideration, and I guess to clarify, that item is the additional item is on page 8. And that for this subcommittee included an additional bullet that had DDA report on the cost per individual in each waiver program. So you would want to modify the House language and adopt the color page.
Yeah. In light of page 8, let's modify and adopt page 8.
Thank you.
So we'll move the second to adopt color page number 8.
Moving on to page 58, item number 2 would restrict $100,000 until a status on the fiscal compliance audit report findings is submitted. The agency concurred with this and the House adopted.
Move to concur.
It's been moved and second concur with the House on item number 2, page 58.
Moving on to page 59, the original recommendation made by DLS was to restrict $1 million until the Department of Health submitted quarterly reports on the fee-for-service reimbursement system transition. You will find, or I didn't actually write it up. The agency did not respond to this, and the House adopted.
I'd move to modify the language, reduce the restricted amount to 500,000 and change the amount restricted per report.
It's been moved in second. We agreed to modify the language to reduce the amount restricted to 500,000 and change the amount restricted per report. That's item number 3, page 59.
Moving to the bottom of page 60, item number 4 would restrict funds in community services to that purpose only. The agency did not provide a response and the House adopted.
Move to concur.
Moved in second concur with the House on item number 4, page 60.
On page 61, item number 5 would restrict the funds in the community services program that would otherwise be expended for transitioning additional providers into the LTSS system until a report on the transition and the cost of providers and participants transition to the system is submitted. The agency did not provide a response and the House adopted.
I'd move to concur with the House.
We moved in second. We concur with the House on item number 5, page 61.
And there's an additional color page action for your consideration on page 7. This report would be required for MDH to submit on the reservation of waiver slots for emergency placements.
Move to adopt color page 7.
Moved and seconded. We adopt color page 7.
Moving back to the main decision document on page 62 for actions related to the Medicaid program. The first item is language restricting funds until MDH submits reports on the eligibility redetermination process. MDH concurred in part. They agreed with the reporting requirement, but disagreed with the restriction of funds. The first House adopted the language and the restriction of funds. If you turn to page 9 of the separate packet, this is presented, it's the same report request, it's just presented as narrative.
Mr. Chairman, I'd move to reject the House action and move to just modify by adopting color page 9.
It's been moved and seconded to reject the House and adopt the additional color page 9 to request through narrative.
And then moving back to the main decision document on page 63, item 2, this restricts funds pending a report from the department on Medicaid rates and rate setting. This is also was requested in last year's budget bill, but MDH had not submitted the report. The first House adopted this language.
Move to concur.
Moved and seconded. We concur with the House on item number 2, page 63.
Jumping to page 65. Item 3 is annual language that restricts funds under the Medicaid program for provider reimbursements to that purpose. The first House adopted.
Move to concur.
Moved and seconded to adopt, concur with the House on page 3, on item 3, page 65.
Item 4 on that same page reduces $15 million in general funds in anticipation of available cigarette restitution funds. MDH disagreed and the first House adopted the reduction.
Move to concur.
Moved and second, we concur with the House on item number 4, page 65.
Item 5 on that same page would reduce 70 million in general funds and 45 million in federal funds to account for Medicaid's reduced enrollment and hospital spending expectations in fiscal 24. MDH disagreed with this reduction and the House modified this to reduce the full surplus identified by DLS in the analysis to based on enrollment forecasts for next year.
Well, based on enrollment forecast, I would concur with the House modification.
So moved in second we concur with the House modification for item number 5, page 65.
Item 6 that begins on page 65 and goes through page 66. This is narrative requesting a report on the Community First Choice Program and Community Options Waiver Registry and financial data.
Move to concur with the House.
Moved in second, we concur with the House on item number 6, page 65, over to page 66.
Item 7 on page 67 is narrative requesting reports on dental services rates. MDH didn't respond. This again is a repeat from last year. The report hadn't been submitted yet and the House adopted.
Move to concur.
Moved in second, we concur with the House on item number 7, page 67.
Item 8 on page 68 is narrative requesting a report on employed individuals with disabilities program eligibility requirements. Again, this was requested last year. The report has not been submitted. MDH didn't respond and the first House adopted this narrative.
Move to concur.
Moved in second, we concur with the House on item number 8, page 68.
Item 9 on page 69 is more annual language restricting funds for Maryland Children's Health Program provider reimbursements to that purpose. MDH didn't respond. The first House adopted.
Move to concur.
Moved in second, we concur with the House on item number 9, page 69.
And then on page 70, additional first House actions begin. The first action is narrative requesting reports on the Community Options Waiver Care Plan backlog.
Move to concur.
Moved in second, we concur with the House on item number 1, page 70.
On page 71, the second additional House action is narrative requesting reports on MDH developing a remote services model for adult medical daycare.
Move to concur.
Moved in second, we concur with the House on item number 2, page 71.
And then item 3 is reducing funding from a fiscal 23 proposed deficiency in $15 million in general funds. And this is to recognize recoveries from managed care organizations that are resulting from a calendar 2020 risk corridor that the department had planned to revert at the end of fiscal 23. And so the first House adopted this fiscal 23 reduction.
Move to concur.
Moved in second, we concur with the House on item number 3, page 71.
Then moving to page 72 of the main document for the Maryland Department of Health Regulatory Commissions. This first action is narrative requesting a report on the Maryland Primary Care Program. HSCRC and MDH both concurred with this narrative and the House adopted.
Move to concur.
Moved in second, we concur with the House on item number 1, page 72.
And then there's an additional item related to the Health Regulatory Commissions on page 10 of the separate package. This is language that restricts funds contingent on the enactment of legislation, and the funds would be restricted pending receipt of a letter confirming that the Maryland Health Care Commission submitted certain required regulations related to protected healthcare data.
Move to adopt color page 10.
Moved in second, we adopt color page 10.
On page 73 of the main decision document, under the Department of Human Services Administration, DLS is recommending restricting funding pending a report to address repeat audit findings related to DHS's oversight of local departments of social services. The department concurred and the House adopted.
Move to concur.
Moved in second, we concur with the House on item number 1, page 73.
Great. And then on page 74 and 75, DLS is recommending adopting committee narrative, first requesting an update on the department-wide recruitment and retention strategy. The department concurred, excuse me, and the House adopted.
Move to concur.
Moved and seconded, we concur with the House on items number 2 and 3 on page 74, extending over to 75.
The actions for the DHS Social Services Administration begin on page 76. The recommendation by DLS was narrative requesting data on hospital stays and length of stays for youth and out-of-home placement. The agency concurred and the House adopted. On page 11 of your smaller packet is a slight modification for your consideration, adding additional request for how that data is reported.
I'd move to adopt the slight modification on color page 11.
Moved and seconded, we modify the House number 1 item by adopting additional color page number 11.
Recommendation number 2 on page 77 is narrative providing an update on the implementation of provisions of the Family First Prevention Services Act. The agency concurred and the House adopted.
Move to concur.
Moved and second, concur with the House on item number 2, page 77.
Item number 3 on page 78 is narrative asking for a report on implementation of a new foster care provider rate structure. The agency concurred and the House adopted.
Move to concur.
Moved in second, we concur with the House action, item number 3 on page 78.
And item number 4 on page 79 is annual language restricting funds in the foster care maintenance payments to that purpose only. The agency concurred and the House adopted.
Move to concur.
Moved in second, concur with the House action, item number 4, page 79.
And item number 5 on page 79 is similar annual language restricting funds in the in the child welfare services program to that purpose only. The agency concurred and the House adopted.
Move to concur.
Moved in second, we concur with the House on item number 5, page 79.
And item number 6 on the bottom of page 79 and continuing on to page 80 is narrative asking for a report on child welfare data and staffing. The agency concurred and the House adopted. Page number 12 and 13 of the color page packet includes a slight modification to that for your consideration.
Mr. Chairman, I move to modify the House action by adopting both page 12 and 13 of the color pages.
It's been moved and seconded to modify item number 6, page 79, and adopt additional color pages 12 and 13.
That's all for Social Services Administration.
Okay, on page 82 for DHS Child Support Administration, DLS is recommending adopting committee narrative requesting 3 reports on child support performance. The agency concurred and the House adopted.
Move to concur.
Moved and seconded, we concur with the House on item number 1, page 82.
There's an additional item for your consideration on page 14 of the color page packet, adopting committee narrative requesting a report on the CSA's efforts to fill vacant positions that have been unfilled for more than 1 year.
Move to adopt color page 14.
Moved and seconded, we adopt color page 14.
Turning to the Family Investment Administration on page 84. The first DLS recommendation was committee narrative requesting the final number of contractual full-time equivalents that are transitioned to state regular positions. The agency concurred and the first House adopted.
Move to concur.
Moved and seconded, we concur with the House action for item number 1, page 84.
On page 85, recommendation 2 was to restrict the funds in the assistance payments program to that purpose. The agency disagreed, preferring to have flexibility in their budget, but the House adopted.
Move to concur.
Moved and seconded, we concur with the House on item number 2, page 85.
Recommendation 3 was to delete $100 million of federal funds in the SNAP program due to lower benefit levels. The agency concurred and the House adopted.
Move to concur.
Moved and seconded, we concur with the House action for item number 3, page 85.
Recommendation 4 begins on page 86 and continues on to the next page. This is committee narrative requesting a report on application processing times, denial rates, and case closures. The agency concurred and the House adopted.
Move to concur.
Moved and seconded, we concur with the House on item number 4, page 86.
Beginning on page 87 and continuing to the next page is a recommendation for committee narrative. This is mostly annual narrative requesting information on children served through the summer SNAP program, but it does this year request some additional information about the implementation of the new nationwide summer EBT program that'll begin in 2024. The agency concurred and the House adopted.
Move to concur.
Moved and seconded, we concur with the House on item number 5, page 87.
Recommendation 6 on page 88 was requesting the spending related to the pandemic EBT program and the new summer EBT program be separately identified in the budget. The agency concurred and the first House adopted.
Move to concur.
Moved and seconded, we concur with the House for item number 6, page 88.
Recommendation 7 is the standard language that you see when there are 4 more repeat audit findings. The agency concurred and the first House adopted.
Move to concur.
Moved and seconded, we concur with the House on for item number 7, page 89.
On page 15 of the separate package, this is committee narrative that requests a report on efforts the agency has made to amend the regulations to exclude federal housing subsidies from the calculation of income, and then some related information if they do, if they have made that change.
Chairman, I move to adopt color page 15.
Moved and seconded, we adopt color page 15.
And that's all I have for you.
On page 91 of the decision document is the DHS Office of Home Energy Programs. The first recommendation was to adopt narrative requesting a report on energy assistance application processing times and denial rates. The agency concurred and the House adopted. On page 16 of your additional pages, there was a slight modification for that for your consideration, asking for additional detail on energy assistance applications.
Mr. Chairman, I'd move to modify the House action by adopting color page 16.
It's been moved and seconded. We modify the House action, item number 1, page 91, and we adopt additional color page number 16.
On page number 92, the second recommendation was narrative requesting a report on the status of the implementation of categorical eligibility for energy assistance programs and the establishment of a centralized administrative model. The agency concurred and the House adopted.
Move to concur.
Moved and seconded, we concur with the House on item number 2, page 92.
Turning to the last page of the main decision document, 94. This is for the Department of Housing and Community Development. DLS recommended narrative requesting that broadband programs be uniquely identified in the budget. The agency concurred and the House adopted.
Move to concur.
Moved and seconded, we concur with the House on item number 1, page 94.
And I have a few color page items for your consideration. First, on page 17 of the color page packet, this is narrative requesting information on the broadband planning process and how the department is looking into workforce considerations in that planning.
Move to adopt.
Moved and seconded, we adopt color page number 17.
On page 18, this is also narrative requesting a report from the Housing Authority of Baltimore City on the number of units that they operate that have air conditioning and the number that don't.
Move to adopt.
Moved and seconded, we adopt color page number 18.
Finally, color page 19. This is narrative requesting that DHCD study the potential for a statewide emergency rental assistance program.
Move to adopt.
Moved and seconded, we adopt color page number 19.
That's all I have.
Mr. Chairman, I would move to move adoption of the subcommittee report.
Been moved and seconded, we adopt the subcommittee's report. Just want to say thank you to each and every one of you all for your due diligence, your hard work, especially to those still left. I see Sam, I see Emily, I see Tanya, I see Naomi, I see Ann, and of course, Ms. Morgan Smith for helping me route through this. I would be remiss if I did not look at my wingman and think about Philip and also Taylor, who's been making sure that every mic is always mic'd. Colleagues, just a pleasure to be able to work with you all. My first time on this subcommittee, so I say thank you. And this is it.